Why are lupus Raynaud's treatment options often limited? Living with lupus can feel like navigating a complex puzzle, especially when it comes to managing symptoms like Raynauds phenomenon. Raynauds causes blood vessels in the fingers and toes to spasm in response to cold or stress, leading to color changes, numbness, and sometimes pain. Many people with lupus experience Raynauds, but treating it effectively can be challenging. The reason lies in the underlying complexity of both conditions and the limited options available that are backed by solid scientific evidence. Lupus is an autoimmune disease where the immune system mistakenly attacks the body's own tissues, causing inflammation that can affect many organs. When Raynauds occurs in lupus, it's often part of the broader disease process, making treatment more complicated. The primary goal is to prevent tissue damage and improve quality of life, but the options are often limited because of how individual the disease can be and the lack of specific therapies targeting Raynauds directly. Most treatments for Raynauds in lupus focus on lifestyle changes and medications that help improve blood flow. For example, avoiding cold exposure and stress can reduce the frequency of attacks. Medications like calcium channel blockers are commonly prescribed because they relax blood vessels and help prevent spasms. However, these drugs don't work equally well for everyone and may cause side effects such as headaches or swelling, which can limit their use. More advanced treatments, such as vasodilators or drugs that widen blood vessels, are sometimes used but are not always effective or suitable for all patients. In some cases, doctors may recommend other medications or therapies, but the evidence supporting their use is limited. This is partly because Raynauds in lupus can vary greatly from person to person, and what works for one individual might not work for another. Another challenge is that Raynauds can be a symptom of more severe blood vessel problems or other complications of lupus. When this occurs, treatment becomes even more complex, requiring careful monitoring and a tailored approach. Since lupus itself is a disease with unpredictable flare-ups and diverse symptoms, managing Raynauds often involves balancing multiple medications and strategies, which can limit options. Research into new treatments is ongoing, but currently, there are no cures specifically for Raynauds in lupus. The treatments available are aimed at symptom relief and preventing complications, but they are not always fully effective. This is why treatment options are often limited, and why close collaboration with healthcare providers is essential to find the best approach for each individual. In summary, the limited treatment options for Raynauds in lupus stem from the disease's complexity, individual differences, and the lack of targeted therapies backed by extensive research. Managing Raynauds requires a personalized approach, combining lifestyle adjustments and medications, with ongoing medical supervision. If you or someone you know is dealing with this, it's important to work closely with a healthcare professional to develop a plan that best suits your specific needs. Remember, advances are being made, and staying informed and proactive is key to managing lupus and its symptoms effectively.